I want to talk to you about trauma. Trauma is something that can occur on multiple levels. There is a collective trauma that's been occurring in our country for a long time. We could look at certain events that have taken place that affects everyone at some level. For example, 9/11. That was a time when I was very active in working with different groups as an employee assistance manager, American Airlines, Cantor Fitzgerald, different groups, in terms of looking at the impact of that event. I've also worked with high schools after shootings, trying to help the staff and some of the students who are impacted by that. In addition to that, I've been there after crisis situations. So there's those types of major events that affect all of us. One could also argue that the recent election, doesn't matter what political side you're on, has had a profound impact on both mental health practitioners and clients. And politics have divided our culture, society. It's been a time where people have become disunited, disconnected, unfriended in general. So there's those types of traumas. And then there's specific psychological traumas that occur along what we call a trauma spectrum continuum. That could be such things as phobias or anxiety, general anxiety, specific phobias, or it could be more generalized trauma. What we've come to learn about trauma is that trauma can actually impact people really differently. There are some people who've been through trauma who actually function really well. In fact, most people who've gone through trauma really are functioning pretty well. They're highly resilient. I find it fascinating to look at what are the difference between people who are highly resilient, who've experienced very significant events, and those who essentially struggle. And it's unpredictable sometimes who will be the ones who struggle and who are going to be the ones who are really resilient. But I've studied this a lot. There's some really interesting books that I would recommend to all of you who are watching this. One is Body Keeps the Score by Van der Kolk, which really takes a look at a lot of the latest research on trauma. And an older book, The Trauma and Recovery by Judith Herman, very effective book I'd recommend to everyone. And there's other books like Courage to Heal. But what really matters the most is that when you're trying to get through a trauma, you need somebody who really can make you feel emotionally safe, and somebody who can help you develop your own tools and your own internal resilience so that you can be effective in overcoming any trauma you've experienced. Some of the tools that I like to use are things like EMDR, which you can look up, emdr.com. I like to do something which is called thought field therapy or tapping technique. I also like using cognitive behavioral therapy. Sometimes medical hypnosis is another technique I'll use. In addition to that, there's heart math, which has been highly researched. I also take a very holistic and collective approach and take a look at your entire way of operating in the world. What can be impacting your ability to function at your absolute best? Sometimes trauma events can actually lead to better outcomes. If you can learn from your trauma, learn from anxiety, learn how to manage it. Lastly, I'll say that acceptance commitment therapy has a lot of really good results in terms of a technique and model of therapy. So I like to use acceptance commitment therapy as an approach as well in helping people work through trauma. So if you've been through any kind of anxiety, phobia, trauma of any sort, I would look forward to the opportunity to see if I can make a difference in your life or refer you to somebody else who can also be effective. Thank you.